Good morning, everyone, and welcome to the 2025 Globe Summit. Thank you for joining us. I'm Shira Center, the VP of Innovation and Strategic Initiatives at Boston Globe Media. I'm also the co-founder of this event, and I'm so proud to share that this year marks our biggest and, I believe, most meaningful summit yet, a reflection of conversations, insights, and connections that this event continues to foster year after year. I want to extend a special thank you to Johnson & Johnson for sponsoring this morning's opening breakfast. Their support allows us to create spaces like this where meaningful dialogue and collaboration can flourish. I hope you'll stick around after the breakfast to take part in and hear from our incredible lineup of speakers, including Governor Maura Healey, The Onion founder and CEO Ben Collins, Vision and Justice founder and recent American Book Award winner Sarah Lewis, and many more. Thank you again for being here and for helping make the Globe Summit a space for innovation, insight, and meaningful discussion. And with that, I am thrilled to introduce Aisha Williams from Johnson & Johnson. Thank you.
Good morning and welcome. I am Aisha Williams, Global Lead of Healthcare Workforce Strategies and Programs for the Global Health Equity Organization of Johnson & Johnson. At J&J, we believe health is everything. For nearly 140 years, Johnson & Johnson has addressed the world's most pressing health challenges with groundbreaking solutions leading to healthier lives. Although we are a global company, much of our innovation, discovery, and R&D takes place right here in Massachusetts. We have approximately 5,000 employees at 9 sites across the Commonwealth, with 1 million square feet of manufacturing, R&D, distribution, training, and office space. Our workforce is our lifeblood, and we do our best to support our employees and the healthcare workforce more generally. As a proud example, for more than 125 years, Johnson & Johnson has been proud to advocate for, elevate, and empower healthcare professionals, and most especially the backbone of healthcare, nurses and community health workers. Our objective is to attract, strengthen, and empower a thriving health workforce, empowered to advance access to quality care. To go deeper on J&J and other leading support for the health workforce, it's my pleasure to introduce this morning's fireside chat. Joining us today are Anna Caravaggio and Corey Feist. Anna is Vice President of Global Health Equity at Johnson & Johnson, where she leads cross-functional teams to develop strategies that address care gaps in underserved communities. Corey Feist is the CEO and co-founder of the Dr. Lorna Breen Heroes Foundation. Corey's advocacy efforts resulted in the first federal law focusing on improving health worker lives, the Dr. Lorna Breen Care Provider Protection Act. Please join me in welcoming Corey and Anna. Thank you.
Good morning, everyone. Thank you so much for joining us this morning. Corey, I'm going to start with a question to you. You and I have known each other for a while now. You have a very compelling reason why you started up this work. Will you share with the audience what you've already shared with me?
Would be happy to, and thanks for having us this morning. Thanks to the Boston Globe, thanks to Johnson & Johnson for sponsoring this breakfast discussion. So I'm here because I'm the CEO and co-founder of the Dr. Lorna Breen Heroes Foundation, which was founded in the name of my sister-in-law, Dr. Lorna Breen, this incredibly accomplished emergency medicine physician and leader based in New York City. In a very short period of time, Lorna went from treating COVID-19 patients to contracting the virus herself and then returning to the workplace too soon. But because of the stigma around taking a break in healthcare, let alone self-care, Lorna pushed on when she was incapable of doing so, to a point where she broke, needed mental health treatment, and ultimately, citing the stigma around losing her license and her hospital privileges for getting that treatment, she took her life at the age of 49 in April of 2020, just at the beginning of the peak of the pandemic in New York City. At that time, I had been a healthcare executive for over 20 years at the University of Virginia Physicians Group down in Charlottesville, Virginia, where I'm from. And but I wasn't a clinically trained leader. And so the language that we heard from her around the stigma and the concerns that she expressed were new to me. The day after Lorna died, over the family's objection, her cause of death was revealed to the public in a large national publication. Not this one, by the way. But that opened up a floodgate of feedback to our family and for me as a healthcare leader that I hadn't heard before. Concerns around taking care of the workforce and their own mental health challenges. And so we began the Lorna Breen Foundation because after hearing from thousands and thousands of healthcare professionals for weeks and months, and it turned out to be 3.5 straight years of hearing from people that we didn't know the day before, we couldn't ignore this issue. So we created the Dr. Lorna Breen Heroes Foundation with the mission of supporting and improving the well-being of all healthcare workers. We focus on removing these mental health penalties and stigma through our Champions Challenge program. We focus on scaling operational improvements through our Caring for Caregivers program. And we've been advocating for health workers at a policy level, notably through the Dr. Lorna Breen Healthcare Provider Protection Act. But I want to point out something in this work and for this conversation today. This has been a crisis that has been brewing in the background for many, many years. But it's not a crisis of individual failure by our healthcare workers. This is a failure of the system. This is the failure of the operations. This is a failure of the culture, not of our individual health workers. So it's incumbent upon all of us to wrap our arms around the healthcare workforce like we've done with Johnson & Johnson through our all-in through our all-in Wellbeing First for Healthcare Coalition, which we created with J&J in 2021. Wrap our arms around the healthcare workforce. Tell them that we see them as people before we see them as healers, let alone heroes. And look at these issues from the root cause and create systemic change that benefits our healthcare workforce and ultimately our patients for years to come.
Thank you so much. As you can hear from the story that Corey just shared, there's so much work to be done. Our audience represent health systems and many other important players in Massachusetts. Please share with the audience, where does Massachusetts sit in this compelling journey?
And I've learned that doing thousands of keynotes over the last few years, you need a Venn diagram and or slides with you wherever you go. So I've got a couple slides to share, and nothing better than a map too, right? So what you'll see here is an image of the change we've made in the United States, including in Massachusetts, to remove these inappropriate questions that healthcare workers are asked. As a lawyer, I was never asked when I applied for my license, have I ever been to treatment or therapy? But if you're a physician, a nurse, a pharmacist, a dentist, or other health worker, you're asked inappropriate questions about your prior mental health. So when you ask about Massachusetts, I point to the map, and this is our Champions Challenge map. And when you go to our website at drlornabreen.org, you'll see this depicted. On the left side, you'll see a bright blue map. That's a map that's interactive. It will show you the hospitals who have taken this work down to their level and removed inappropriate questions from their credentialing and privileging forms that ask these questions. I'm going to show you in a minute, but not just yet, a list of those Massachusetts hospitals. On the second, the purple map, you'll see all the medical licensing board changes. Now, what that means is, if it's a bright purple state, we have removed those barriers for all licensees in the state. When we began this work a couple years ago, there were 17 purple states, and there are now 40 purple states for medical licensing. We only have, though, about 7 or 8 for nursing. We only have about 7 or 8 for pharmacy and dentistry. So the very first thing that I would say, and if you go to the next slide for us, you'll see the 20 hospitals in this Commonwealth who have been awarded our Champions Challenge badge. My understanding is that's about 20% of the hospital systems in the state. So we need to keep going in Massachusetts to let the workforce know that these changes are here if you're in an organization that has our badge, and if it's not, that we value those people as individuals and we're making these changes. We have to communicate these changes. This is table stakes for us. So when you ask about how they're doing in Massachusetts, what I would say is making great progress towards supporting the mental health of the healthcare workforce and growing. Now I want to quote, to kind of the second part of my answer, I want to quote a nurse who took her life in Ohio in setting this up. So Tristan Smith was 29 years old. She was a nurse in Ohio, and after she took her life, her dad found on her iPad a letter that she had written. This letter was entitled "A Letter to My Abuser." This wasn't someone she was in a romantic relationship with. This was a letter to her employer. And Tristan's letter, which I read to Congress just last year, went on to say, "Just when we think we are getting the love and support we deserve, we get a pizza party and pens for the healthcare heroes." Now, what I would tell you is Tristan's sentiment is felt across the country, including in Massachusetts, by the workforce. They have been flooded with a message of, you must be more resilient. Use this EAP, this Employee Assistance Program, which is very valuable. Use these apps that we have. But the message needs to transition in this Commonwealth as well as across the country to one of, we are getting at these issues from the root cause operationally. What is it, those pebbles in your shoe that Muhammad Ali used to refer to? It's not the pebble, it's not the mountain above you or in front of you, it's the pebbles in your shoe that prevent you from achieving your goals. It are those pebbles which often find themselves in the way of overly bureaucratic processes or tasks that we're asking our workforce to do, taking them away from the bedside. And so our Caring for Caregivers program that we've launched in Virginia, North Carolina, New Jersey, and Wisconsin is a perfect way to get organizations rallying around the workforce from looking at these issues from the root cause. And so we have a road to go in Massachusetts. We've got great progress. If you go to the final slide, there's a slide that shows a QR code, because no presentation is complete without a QR code these days. But this will take you to the Champions Challenge toolkit to remove those mental health barriers, and that's the badge you'll receive. So can I ask you a couple questions?
Sure.
Because I will tell you, when I first met with Johnson & Johnson in 2020, I was thinking, okay, this is a med tech and pharmaceutical company. What in the world are they doing in the space of taking care of healthcare workers? So what in the world are you doing, Anna, in the world of taking care of the workforce?
Thanks so much, Corey. If you look at J&J's history, for over 100 years, we've been focusing on issues that affect healthcare workers. And whether you look at our credo, which is a document penned in the 1940s that really describes the ethos of how J&J operates and makes decisions, or to our most recent launch of J&J Care Community that really focuses and amplifies the issues that affect healthcare workers, the programs that support healthcare workers, to our deep history, our most recent past. This is an area of focus for us. I will just take 1 second to read the first sentence of the third paragraph of the credo to give you a sense of why this has been an area of focus for us. We start with, "We are responsible to the communities in which we live and work, and to the world community as well. We must help people be healthier by supporting better access and care in more places around the world, and we must be good citizens, supporting health, education, and community well-being." And Corey and I met yesterday evening, and he asked me a similar question: why is J&J focused here? And we think that to create better access to healthcare in the world, we really need to focus on caring for those who care, and that's our healthcare workers, those that come to work each day to make our health systems work.
That's amazing. And from the moment our foundation came together with you all to create our All-In Wellbeing First for Healthcare Coalition, we felt that credo, and we continue to feel it in all of the workers that we've met with in Johnson & Johnson. And so thank you for your support of all of our healthcare workforce. And we completely agree. In order to have a healthcare delivery system, you have to have a thriving healthcare workforce. Can you tell us a little bit more about the specific programs and the impact of those programs that you've had, and are any available here in Massachusetts?
Thanks so much, Corey. When we look to invest in programs that support healthcare workers, we agree with Corey. It can't just be about providing apps, asking healthcare workers to be resilient, and putting the onus on healthcare workers. So we've been investing in programs that really focus on some of those root causes that Corey talked about. So one program, the first program I'll highlight is in partnership with the AACN, the American Association of Critical Care Nurses. They've developed a program that really focuses on healthy work environments for nurses. And in partnership with the AACN, we have queried health systems to really improve the healthy work environments. They have a very robust program where they take an entire hospital to ensure that the environments that nurses are working in are healthy and that they can ensure less burnout, better patient outcomes, and it results in retention rates. And we know that nurses leaving the workforce is a big expense and cost to health systems, but also to patient outcomes ultimately, which is what we're there to support. We're really excited that we have our first state cohort. 10 hospitals here in Massachusetts have banded together because they recognize that doing it as individual hospitals is great. Coming together across the Massachusetts health and hospital system really provides the opportunity to learn from one another in terms of how to make the program more sustainable, more effective, et cetera. So that's one program I would focus on in Massachusetts. The second is J&J sponsors a fellowship. It's a one-year program focused on nursing leaders. And the nursing leaders are really trained to think about innovation, systems, system changes that can really affect how care is delivered, how burnout comes to be, and how patient outcomes can be improved. I'm really happy to say that we have one of our fellowship cohorts here in Massachusetts. I'm going to read that hospital name so that I don't get it wrong. The Beth Israel Lahey Health in Burlington, Massachusetts is participating in this fellowship program. And then the last one that I would highlight, Corey, is the program that we've partnered with you on. And we're so privileged to continue to partner with you on that program.
Thank you, Anna, and thank you for getting deeper into the impact work. We talked about this last night. It is so critically important that we not just sit here as talking heads and healthcare leaders paying lip service to this. We need to get deeper into these issues because these are solvable and achievable issues. So I was told once, I came off stage at a keynote and a gentleman took me aside. He said, "Boy, Corey, you give a great talk. How do you know anybody does anything with it when you walk off stage?" I paused and I thought, okay, I need to leave them with one thing for them to do, and then I can go back. So what is your one thing that you would give this audience online and in person today for them to take away that we feel like we need to do to support the mental health and well-being of our healthcare workers?
It's very much a continuation of what I just described, continuing to look at what is the root cause of the burnout, the kinds of situations that Lorna faced herself, and how can we support changes in the system through innovation, through banding together. Each of you represent a system, a media outlet, government. You can affect policy, how people perceive healthcare workers, innovation within health systems. So I would encourage each of you to think about these issues and how do we not put a Band-Aid on some of the issues, but really look to what is the root cause that is creating the kind of burnout that we see, the retention issues we see with healthcare workers, and how can we be supportive in media, in policy, in programming. So I would turn to each of you to join us in this fight to really keep healthcare workers healthy so that they can care for those that are in health systems and improve patient outcomes. And so, Corey, you've thought about the one thing.
Yeah.
What's your one thing that you're focused on? We talked about focus last night, and delivering these kinds of programs really requires you to stay steadfast and focused. What's the one thing you would leave the audience to consider?
I knew you were going to say that, and I didn't think about it. I'm kidding. We have learned a lot in this work. And for those leaders in the room and online who are not clinicians, it will surprise you, or it may surprise you to know that the rate of suicide among healthcare workers in the United States, particularly female nurses and female physicians, is almost twice that of the general population. 400 physicians die every single year, that's over one a day, by suicide in the United States. Year and a half, 2 years ago, the American Hospital Association published a suicide prevention guide, which identified 3 key drivers of suicide among health workers. The challenges that Lorna faced and the challenges that many face around accessing mental health care without fear, or with fear, frankly, need to be removed. Those barriers need to be removed. So our Champions Challenge with the QR code that I showed earlier is the one thing that I would challenge everyone to do. We are now benefiting over 2 million health workers in the United States through that program alone, which, by the way, is at no cost to anyone. We work under a grant to do that work. We can benefit 22 million healthcare workers through this program. And so that is my challenge to everyone in this room and online, is to join our Champions Challenge as your one way of letting the healthcare workers know that they are seen, know that they are heard, and know that they are human.
Thank you so much, Corey, for joining me today, but also for the work that you do each and every day. And with that, I'd like to welcome back Shira to the stage.
Thank you, Corey and Anna, for such a wonderful conversation to kick off our Globe Summit. And thank you to Johnson & Johnson for your partnership on this event. You make meaningful events and conversations like we just heard possible. Please stick around. Our main programming will resume at 10 a.m. and we are just getting started. See you back here soon. Thank you again.